You're watching CTOM TV. Knowledge is power.
Standard treatment for colon cancer typically begins with surgery. Sometimes they will do preoperative chemotherapy or radiation therapy to shrink the tumors if it's too big and they think there's going to be complications with the surgery. Then after surgery, typically you get what's called FOLFOX, and that's a specific combination of drugs, 5-fluorouracil, which is basically a derivative of mustard gas, leucovorin, and that helps the 5-fluorouracil become absorbed in the body. And then a drug called oxaliplatin, which is a platinum compound chemotherapy drug made out of platinum, which is the thing that you find in catalytic converters of cars. So you could go to the next slide.
Okay.
And then also there's another protocol called Capox, which uses capecitabine instead of 5-fluorouracil. The drug's also known as Xeloda, and that's spelled with an X. It's a oral formulation. It's called a prodrug. And basically what it is it's a form of 5-fluorouracil that has a coating that prevents it from being broken down until it passes the liver. And then it becomes active. And that way it doesn't damage your digestive system as you're taking the pill orally. So it's an oral formulation of it called a prodrug. And then once tumors recur after FOLFOX, the standard care is irinotecan. And so that's evolving, it's called FOLFIRI. It's actually adding this drug, irinotecan, to the protocol.
But just to be clear, these are all just different types of chemotherapy.
Yes. Okay, can you go to the next slide?
I can.
So
I just thought here was a good point. Sorry to interrupt you, Alex. I thought it would be good before we start talking about targeted therapies, whether in standard or precision oncology, for you to tell us a bit more about what a targeted therapy is.
Yeah, by all means. And there are 2 targeted therapies being used in colon cancer right now, although they're not used as much as they should be, and in the same manner they should be. So targeted therapy is a drug that targets a specific mutation in your DNA. So it's a genetic feature of your cancer. So cancer is a disease of the genes. We have roughly 25,000 or so different genes in our body. And the genes have many different functions. They basically are the plans that make up our bodies. And what happens in cancer is the genes that control the growth and development of the cells, both the gas that cause, you can think of it as a gas pedal and a brake pedal, the genes that turn on the cells and cause it to copy and reproduce in order to fix damaged tissue, they get damaged and they get turned on permanently. And then the brakes that would prevent a cell from rapidly reproducing, called tumor suppressor genes, get damaged too. So together, those are called oncogenes, and oncogenes cause cancer, and tumor suppressor genes prevent cancer or stop it from happening if it does happen. And so you get a combination of mutations in various oncogenes and a combination of mutations in various tumor suppressor genes. And together, what that does is it causes a small group of cells in a certain part of the body to grow uncontrollably, and those cells can live anywhere else in the body and move around. And that's basically what cancer is. So the mutations that happen in these genes and the genes that happen, there's both a combination of mutations that are common to certain cancers, and then there's also mutations that are unique to every individual. So a targeted therapy will target a specific mutation that occurs in a specific gene.
Thank you.
And so the beauty of targeted therapies is they don't have the same side effects as standard chemotherapy. Standard chemotherapy works by basically interfering with any cell that happens to be growing and reproducing while the drug is in your body. So chemotherapy drugs don't last very long. They are usually injected or they're taken orally, but they don't last in your body in an active form for very long, because if they did, they'd kill you. Basically what they do is they kill any cell that happens to be copying and growing, whether it's a cancer cell or a normal cell, And typically cancer cells are growing 24 hours a day, 7 days a week, whereas our normal cells may only grow in little short bursts here and there, just to replace damaged tissue as we age and grow. So the beauty of targeted therapies is they have far fewer side effects, and they target the actual stem cells, and that's the goal of it. Cancer is a disease of the stem cells that cause certain cancers, or unique certain stem cells that cause certain tissues to grow uncontrollably. These targeted therapies are able to affect them, and chemotherapy drugs don't affect the stem cells. So that's something to consider. However, in order to determine which one of these targeted therapies is going to be best for someone, you have to do genetic testing. And when I say genetic testing, I mean tumor DNA testing. And that's a process where they isolate the tumor cells from a biopsy, and then they look at the mutations that are unique to the tumor and not in your normal cells. So in other words, these mutations have caused your normal cells to turn into tumor cells. Okay. So in standard treatment, there is two different approaches. Now, one of the reasons they test you for BRAF mutations and RAS mutations, it can be KRAS, NRAS, HRAS, and PIK3CA mutations, is there's a class of drugs called monoclonal antibodies, and they target a pathway called the EGFR pathway. So typically the EGFR pathway is overexpressed in colon cancers and many other cancers. So if you have a cancer that does not have any mutations in the BRAF or the RAS or the PIK3CA genes, and these are all three different types of genes, then you can get EGFR monoclonal antibodies. The two drugs are called cetuximab and panitumumab, and they can extend your survival by a few years. So, but if you do have mutations in these drugs, then you can't, or in these genes, then you can't get these drugs. So in that particular case, there's a drug called Abastin, also known as bevacizumab, and that is an inhibitor of a process called angiogenesis. So angiogenesis is the tumor-based recruitment of blood vessels. It's an incomplete process. There's a bunch of different steps to building blood vessels in the process called neogenesis. That's the normal production of blood vessels. In angiogenesis, it's specific to the tumors, and it creates blood vessels that are very leaky. They don't seal them off. So the final stage of blood vessel formation in neogenesis is sealing of the blood vessels linings, and that process does not happen in angiogenesis, which really benefits the tumor because then they have leaky blood vessels, and that allows the tumor cells to spread easier. So Avastin works by inhibiting the tumor induced formation of blood vessels called angiogenesis.
Thank you for watching CTOME TV. Subscribe below and stay informed.